Good morning, ladies and gentlemen. Welcome to another episode of Monitor Your Health, the program where we educate the public on contemporary health issues. Today, we're going to talk about fibroid. Fibroid is a common condition in ladies. It's first described in 1793 by a UK-based physician. We know that it affects a lot of Black women, and we feel it's important for us to come here today and discuss it. So with me, I have Dr. Angela Esiwe, a general practitioner in the UK, who will be helping us to deal with questions today. You're very much welcome, Dr. Esiwe.
Oh, thank you, Femi, for inviting me. I'm privileged to be talking to everyone today, and thank you for those that have signed in. I know there's a lot of you from Nigeria and hopefully a lot of you from the UK. It's a bit earlier for us from our side. As Femi says, I'm Dr. Angela Adaku Esiwe. I'm a family physician in the UK, or GP, but I qualified 20 years ago as a medical doctor. I have got a background of gynecology and experience in sexual health, and I'm pleased to be here with you today. Thank you.
Thank you so much. So we're talking about uterine fibroid. Yes. In the next 30 minutes to 40 minutes, we'll be answering questions, and we hope to be able to educate our viewers. Mm-hmm. So what's a fibroid?
Well, fibroids, they're benign growths found in the muscle of the womb. Another term for the womb is the uterus. And when I say benign, it means it is not harmful. So it's nothing like cancer. And there are different parts where it can grow in the womb. The womb is, as we all know, is the female reproductive organ. And it's like basically it's like a container like this. And sometimes you can have fibroids growing within the space, within the muscle wall or outside the muscle wall. So as a consequence is, you may have symptoms, but a lot of people don't get symptoms.
Right. Okay, thank you so much. So it is a growth within the uterus.
Yes.
Now, yeah, and then you've described that it could be within or outside, mm-hmm. or, you know, there are a few things that you've discussed there. So what are the causes, or what are the things that cause this fibroid?
Well, that's a good question. In actual fact, no one knows the exact cause of fibroids, but there are a lot of associations. And amongst Black women, it's more common, 3 times more common than white people. So because of this, therefore, there's definitely an ethnic ethnicity association. So it depends on where you come from. Also, we find if there is a family history of fibroids in your mother or your sister, first-degree relatives, there's a higher chance that you will have it.
Right.
And what we think causes it is due to an association with a hormone, the female hormone called estrogen, which is produced by the ovaries. But we also get estrogen in the fat cells. The good thing is that as we get older, towards the extreme of age, during menopause, estrogen in our body is less, so fibroids tend to shrink. And there are other protective factors like, for instance, pregnancy as well helps shrink fibroids as well. So as an overview, we don't know why, but there are lots of things that make you more likely to have a fibroid.
Right.
Yeah.
So for a lady, because I know it's quite common, you know, amongst well, supposedly from the questions and the, you know, things that we've been hearing, it sounds like something quite common amongst the Blacks.
Yes.
So why is it? I mean, any particular reason why we have more predilections among the Blacks than the Caucasians?
I mean, there hasn't been a lot of research done, but we do know that obviously if it's running in family, there must be links with genetics, and it's more common in blacks. But it's not like one of those conditions that if your mother has it or someone in your dad's family, you would definitely have it. That doesn't happen. It doesn't follow that direct link.
Right.
Yeah.
Okay. So now, how if somebody has this fibroid, obviously, how do they know? How would they know that? Because a lot of things, especially when we look at what happens here in Nigeria or in Africa, there are a lot of taboos and things, and people associate a lot of things to to the other. How do people know precisely that the issue they have at hand is actually fibroid and it's not something else? So the presentation and how the signs and symptoms they pick.
Okay. Now, what I always tell people is if you're found to have a fibroid, don't panic, because in actual fact, in our lifetime, most of us as women will have a fibroid. In majority of cases, actually, you don't have symptoms. So what they generally say, for those of us of reproductive age, between the age of 16 to 50, 77% of us will probably have a fibroid, but only 30% to 50%, so 1 in 3 or 1 in 2 will have symptoms. So you could have a fibroid and have no symptoms at all. But those that have symptoms, you can present in many different ways. Heavy periods is a very common way that we present with heavy periods, with fibroids. Some people don't get heavy periods, they will get what we call pressure symptoms. And pressure symptoms is because of your womb is in the pelvis and you've got different organs around it. So you've got your bladder that sits in front of it, and you've got your bowel, which is behind it. So if you imagine a growth, if it's pressing on your bladder, it will cause some women to come and present with going a lot to the toilet, rushing to the toilet. If it presents with the bowel, this is the bowel, this is your womb, pressing on your bowel, you become constipated. Some people do get pain with it as well. And the one thing I try to tell people as well, because of heavy periods, you can get symptoms from heavy periods. So it's always important as a woman, if you're feeling tired, it could be because you're having heavy periods. Not everyone that has a heavy period has a fibroid, I must say so. But if you do have heavy periods, you may present with tiredness, you may present with faints. But luckily, this happens in very rare occasions. And then there's one thing you mentioned about people associate illnesses with certain cultural beliefs, like why is this happening to me? One other issue, which is it is a bit of a sensitive issue, but fortunately it only happens in very rare cases. You can sometimes present with fertility issues or miscarriages, but I'm pleased to say that it is not common. It's not common for this to happen.
Okay, so now a patient or a lady then comes to me and they have heavy periods and things like that. Is that the only thing that is likely to cause it, or there are other things that we need to look out for while we're investigating this patient?
Yes, that's a good question. Like I said, in majority of cases, it may not be due to fibroid. It depends on the age. There's a condition called dysfunctional uterine bleeding where we don't find any cause. It's just the mere fact that you're young, so you will have heavy periods because of that. But we do ask other questions to make sure it is nothing harmful. So we ask questions like, are you bleeding in between your periods when you shouldn't be having a period? Are you bleeding after sex? So that might indicate something else. But there are other common conditions like polycystic ovaries, but I know this talk isn't about that. That can cause irregular periods, and some people's periods are heavy, but some people don't have any periods at all.
Right.
Now, people worry about whether if they've got a fibroid, is it going to turn from a benign growth to a cancer growth. I'm pleased to say that that doesn't happen. There is a condition called sarcoma that is a cancer within the muscle of the wall, but often luckily that is very, very rare, but in some cases, initially it is diagnosed as a fibroid, but it ends up being a sarcoma, but that is very, very rare, very rare.
Right.
And often those people will not present with regular heavy periods. There will be a different history. They would have had treatment and that doesn't work. And ways of picking up the fibroids, you can pick it up from examination from a skilled doctor, or you can pick it up by ultrasound scan, which is a very easy procedure. Ultrasound scan is the scan that we do when we're looking assessing babies. So you have a little probe on your tummy with a gel that can pick up fibroids, and then you can have more advanced examinations like MRI scans, but that's very rarely needed.
Okay. Okay. So, while we ask questions, I have some questions coming up here, so I might just be asking you some questions for the public.
Okay.
Just to tailor to them. So somebody is asking here. Oh, it's gone away now. Okay, I will find a way of going back to that because Now there's a question that somebody asked, and I want to just I think it was talking about they've got a large, fibroid. Does that affect their hormonal balances? Something like that. Well, I will pick the actual question out for you. Now, so now we know that this person is suspected to have, a fibroid, and then obviously they need to be investigated. So what come after? What comes after?
Well, obviously, like I said, it depends on their symptoms. Well, in my sort of setting, a patient will probably come to me complaining of heavy periods or pain with no other symptom. The question about whether fibroids can cause hormonal imbalance, it doesn't. The condition that tends to cause hormonal imbalance is usually polycystic ovaries. But fibroids do not cause the hormonal balance. For the fact that you're having heavy periods, it doesn't mean your hormones are affected. And what I tend to do, I would do for most people a blood count, just to make sure they're not anemic.
Right.
And in the community, we can also organize an ultrasound scan. Yeah. Okay. But fibroid sizes can vary. They can be as small as a pea. That normally doesn't cause any problem.
Right.
And we tend to use fruits to sort of give a guide as to the size. A plum-sized uterus is normal, but if it's anything more than a plum, so an apple, an orange, grape, melon, that is a big fibroid. Yeah. But there are lots of treatments options, so that's the good thing. And in very rare occasions, some people do come with fertility issues. Yeah.
With what?
Fertility, having difficulties to conceive.
Right.
Yeah.
Okay, so this is a question from one of our viewers this morning. If someone knows that they have high risk of developing fibroids, e.g. due to family history, are there anything they can do to reduce their risk?
Yeah, that is a good question. Well, what we tend to say, ways of reducing your risk of having a fibroid for everybody, but you may feel that you need to be aware of this because of your family history, is we tend to say it's important to plan for pregnancies early if it's convenient for you, because that means that you have less estrogen in your system. Naturally, the body, by having a period every month, helps reduce your chances of having a fibroid.
Right.
The combined pill, which is used as a contraception if you are happy to take that for cultural or religious reasons, has estrogen in it. And so what it does, it attaches onto receptors in the womb, so reduces the chance of you developing fibroids. If you have it, it shrinks it. Healthy living is also important. Exercise, watching your diet, because we do know estrogen, the hormone, female hormone, just doesn't come from the ovaries, it also comes from fat cells. So if we maintain our weight, if we're exercising, if we're keeping an eye on our diet, even if we had a small fiber there, it's unlikely to grow. So we wouldn't get any symptoms from it. So those are sort of the general things. They do say a reduced chance of getting fibers is if you're smoking. They've done studies, but I wouldn't advise smoking because smoking gives you other problems. So they tend to say if you haven't had any children, you're more likely to have a fibroid. If you've had many children, you're less likely to. But obviously, there are things that you can't change. If you've got a family history, you can't change that risk. Yeah, but it doesn't mean family history means fibroid. Not everyone gets it.
Right.
Yeah.
Thank you so much. So now, once somebody has been, diagnosed from, investigation,
yeah,
and what sort of treatments are available,
yeah.
for this condition?
Yeah. Well, I always say the first thing is don't panic, because if it is an incidental finding, we don't do anything. We just leave it. And in majority of cases, it depends. It's an individual approach. So it depends on what your symptom is. For heavy periods, if you didn't want to go on any hormones at all, you could try medications like ibuprofen when you're having a heavy period, or mefenamic acid or Ponstan. Or you could try tranexamic acid. Now, if your periods, however, are very heavy, that it causes you to be anemic, in the UK, we recommend the first line treatment as being the Mirena. Now, Mirena, I'll explain what that is. That is a type of coil which is T-shaped, which goes in the womb. And it's a very easy procedure. I do it, so GPs do it, gynecologists do it. It takes 5 minutes. And the advantage of it is that there's a hormone in it called progesterone that helps thin the lining of the womb and shrink fibroids. And it lasts for 5 years. And a lot of people get extreme benefit from it. Over 80% of people, their periods stop. Now, the other side of things is if you want to try for pregnancy, because this is a contraception, that wouldn't be a choice for you. Right. So, and fertility issues is quite complex. So you would need to be referred on to a specialist. But I often say, even if you've had a fibroid, if you haven't tried for pregnancy for up to a year, we wouldn't automatically refer you unless you're having significant symptoms. Yeah.
Right. Thank you so much for that. So let's take another question from the public. And this question is about the size of the fibroid. Somebody is saying, what's the best treatment plan for a large fibroid around 12 millimeter in size?
Okay. That's a good question. Now, we tend to say fibroids that are less than 4 centimeters in size do not necessarily need treatment. Now, with a 12 centimeter size uterus, 12 centimeters fibroid, that can still be treated with the Mirena.
Okay.
Can
I add something to that? She said that it's actually planning to have a baby.
She's planning to have a baby, yeah. If you're planning to have a baby, if you've not tried for up to a year, I would say to carry on trying. If you have tried for a year, then we need to assess it further. Initially, in the community setting, we would assess it with a fibroid, with a scan. But having said that, you have to be aware that there are lots of causes of infertility. It's not just the female. You also have to think about the male. So I would always say, unless obviously I presume if you're not having any symptoms, then, and you've been trying for a year, you should come to see your doctor with your male partner or husband. That's very important. And we would do other investigations to check that your hormones are fine, your blood count is fine. We will check rubella, make sure they're up to date with rubella. We'll also check to make sure there's no infection. So there's simple swab tests we can do to test for things like chlamydia, gonorrhea. Very unlikely that this will happen if you're in a regular relationship, but in the UK, for everybody, whether you have a regular partner or not, these would be the investigations we would do as a minimum before we refer you on to the fertility specialist. And your male partner doesn't get away with it. He also has an investigation, which is called a sperm count.
Right.
Yeah.
Thank you so much. Further questions, actually. So before we go into our, regular question. So
Yeah.
somebody is asking here. Oh, I think this has been answered.
Yeah.
Does fibroid happen in Caucasian, or is it true that it's only in Black and Asian? And I think one of the viewers already answered that Dr. Angela said it's 3 times commoner in the Black or colored people than the Caucasian. So, but it does happen in both. Now, another question is, can fibroid grow? Can it grow back after it's been removed?
Okay. I think very unlikely. I mean, and that is a good question, because I didn't talk about the surgical aspect of fibroids. In some cases, you might need to have some form of surgeries, but there's so many forms of surgeries that you can have. The surgery that I think the person is talking about is might be a myomectomy, where they remove just the fibroid and they leave the womb. And another way is hysteroscopic resection. So you go into the womb and take it out, rather than taking it from a major operation. I think it's very unlikely it will grow back. Yeah, very unlikely.
Okay, thank you so much. So now we have a patient who we already, is been diagnosed, and then they have we already talked about the options of treatments. Are there complications that can arise from the treatments of this condition that patient needs to be aware of?
Now, when you say complications, which specific treatments are you talking about? Do you want me to talk about all of them?
Yes. So if we now know that, they can either have, there are various types of treatment they can have. But for this treatment, are there things that the patients need to be aware of in terms of, complications that can arise? It's just helping them to be able to take decisions.
Yeah. Well, I'll start off with sort of the basic treatments. With iron tablets, very minimal side effects from that. Some people get loose stools, nausea, constipation, but very rare. Tranexamic acid, we usually say take that when you're having the heavy periods. So for the first 3 to 5 days of your cycle. In very rare occasions, well, the cases where we wouldn't prescribe it is if you have a family history of clots, because of the way it works. It works to thicken the blood, so you're not gushing away with bleeding. Ibuprofen and mefenamic acid, people tolerate that quite well. I mean, ibuprofen is a painkiller, but I always say take it with food to prevent reflux symptoms, heartburn, because you can get that with that. And obviously, if you do have history of ulcers, peptic ulcers in your tummy, it wouldn't be advisable to take that. Right. Now, the Mirena is a fantastic treatment option. And during the procedure, what I tend to tell my patients are, even if you haven't had children, because you might want to have the Mirena for heavy periods because you're not ready to have a child yet, it can be removed and your fertility reverts afterwards. So even having it for a year is useful. And I tend to tell people it's 5 minutes of discomfort during the procedure with 5 years of blissful periods, for instance. So some people can get infection afterwards, but it's very, very rare, very rare. For surgery, I think surgery is the one that is the main one that can cause problems. And some people actually need it. They've completed their family, they've had fibroids, and they need to have a hysterectomy. Obviously, any surgery, you have the side effects from the general anesthetic, and you also have the side effects from the surgery. So wound infection, bleeding, and in very, 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 very rare occasions, if you bleed heavily, that can be life-threatening. So what I tend to say is, if you need to have surgery for fertility reasons or because you need a hysterectomy because of heavy periods, do go and see a renowned gynecologist in the UK, in Nigeria. Do your research. In Nigeria, I know there are issues with having blood available. Operation should be planned. Make sure there's blood available, because that helps save lives. Yeah, but the good thing is that if for any reason you do need to have your fibroid removed, I've had lots of successful stories where someone's been trying for a year, they couldn't get pregnant. It's because of the fibroid. It was removed and they get pregnant 6 months later. Mm. So they are successful stories, yeah. So don't give up, please.
Thank you so much, Dr. Esiwe. Yeah. Now, we have some questions here while we're rounding up. Yes. So the question here is, Dr. Angela, can PCOS women develop fibroids?
I mean, that's a good question. They're not actually linked at all. But having said that, us being women, we can have multiple issues going on. And in actual fact, with polycystic ovarian syndrome, not everyone needs to be treated for that. That's why we call it a syndrome. You may have the ovaries that look polycystic, but you don't have any symptoms at all. So it isn't linked at all, but on the off chance you may have it, but I don't think there's been actual studies to show how many people have both. I don't know of that, no.
Thank you. The other question, does the treatment option depend on the location of the fibroid on, what's this one? Fibroid on generally on the size of the fibroid or the size.
Is it possible for me to share a slide? Because I think that will help.
Yes, please.
I'm going to share a slide. Yeah. Can you see it?
Yes, let me just go into my, yeah.
So basically, yes, that is a good question. It depends on where the fibroid is. So this is a picture of a uterus, and this fibroid here is called a submucous fibroid because it's going into the cavity. So for that, you can have it removed. We put a camera, and with a device, we can clip onto it and to remove it. Now, this fibroid within the muscle is called an intramural fibroid, and the fibroid on the outside is called a subserous fibroid. I've got a bigger diagram here. So what tends to happen, usually we find the fibroids that cause issues with miscarriage are the ones within the cavity, because obviously the baby implants here, and so if it can't implant, not the start of the baby or the beginnings, the fetus, then it's unlikely to progress, or you might, if it does, you might have a miscarriage. If, however, for some reason the fibroid within the muscle wall is big, that is affecting it for some reason, we don't know why, or on the outside, you need to have a myomectomy. So that is an open procedure, and what happens is literally coughed out, and I've seen a lot of these procedures done where it's coughed out, and it can look anything from being very small to being very large. Mm. Yeah, I think the largest I've seen it has been the size of a grapefruit that has been removed. And the thing is, a lot of us just don't have one fibroid, we have multiple. I have to own up to say that I have multiple fibroids, and I am being treated with Mirena, and it was a life-saving treatment option for me. But they never, from the scan, they don't always tell you the size. But yes, if you have multiple fibroids, then in the operation, I have seen once where a woman had 3 fibroids removed during the myomectomy. So I hope that answers the question.
Yes, thank you so much. So now somebody is asking, does fibroids shrink with menopause? I think that's been answered before.
Yes.
Yeah. Yeah.
It does, because during the menopause you're not exposed to estrogen, so it shrinks. Yeah.
Another question, all these questions have been answered. I think I'm going to just advise that you go back and watch this episode. So somebody is asking again, does fibroid have any correlation to become cancerous later if left? So I think that's been answered as well earlier.
No, it doesn't. It's an easy question. No, it doesn't.
Yeah, people are just joining now. So now, thank you so much, Dr. Esiwe. So what we're going to, I mean, do you have any advice you want to give our women generally just before we round up this particular session?
Yes, I think I want to do that with a slide,
Okay.
one slide, so it will not take time.
Yes. Okay.
Just bear with me. Well, I think what I may not be able to get to the slide. I don't know. Okay, hang on.
Okay, let's see.
And these slides, if anyone wants it, I'm happy to have it shared. It will be on your YouTube page, did you say?
Yeah, we can put it on the YouTube page.
Yeah.
So if you go to, you just look for Monitor Healthcare Limited, which is LTD on YouTube. This will be uploaded by the end of today.
Yeah, I think generally I would say don't prevent having adequate treatment for any reason. I think really we have to think about it. A lot of us are working mums, and sometimes we delay having birth at a later age.
Yeah.
So for instance, if you're in your 30s or in your 30s, you probably should be thinking about having your children in your 30s or your 40s. I know that's not always possible. And having fibroids with the symptoms can be embarrassing. I've had a lot of embarrassing situations myself. Don't feel embarrassed to come to someone to talk about it. Don't be fearful. Cost, however, can be an issue. Fortunately, that's not an issue in the UK because we have the NHS and cost of treatment is free, even for IVF treatment for fertility, if you need that, or treatment for your fibroids, it is free under the NHS up until a certain age. So that's what you have to be aware of. I'm based in Lincolnshire, but there are different cutoff marks for when you can have treatment. Some areas it's age of 40, some areas it's age of 45. Also, keeping healthy is important because if you're obese, you have a high BMI, your success of having a successful pregnancy is low because that can affect you ovulating. And when you get pregnant, it can cause complications. So keeping healthy is important to do, exercise, healthy food. And forget about all the taboos about saying, oh, it's your fault. And some people do go through embarrassing periods where they have fibroids that's equivalent to 16 weeks, 20 weeks pregnant, and people tell them, are you pregnant? That is quite a sad thing that I have known people go through. But no, it's not your fault. And there are things that can be done for it. Thank you.
Thank you so much, Dr. Angela Esiwe. It's been a very educative period, having you here this past, 30 minutes, 40 minutes. And to the viewers, I hope we've been able to give you some additional information to what you know about, fibroid. We know that fibroid is a very common condition amongst ladies. It's been stated that we have about 50% or 70% of ladies at age 50 years, one way or the other, they would have had, an encounter with this particular condition. Past 30 minutes. We've thrown a lot of light to this, and I hope that you have gained something from them. And you will be able to use this information to prevent, serious complications from this condition. For people that have, issues and they really need somebody to help them, we advise you visit your own doctor. More so, we also have a platform called Area Doc where you can actually interact with our doctors and they might be able to signpost you in the right direction. If you go on your app, you can Google Area Doc. It's one word, AREADOT. Yeah, so it's Area Doc, one word, and then you can just interact with our doctors. They might signpost you, especially if you're in Nigeria. Thank you so much for joining us this episode, and we look forward to meeting you again or seeing you again next week when we come with another interesting topic. You're very much welcome and have the best of the weekend. Bye-bye.